If you live in England and you've had an elective surgery scheduled in the past 2 years, there's a good chance it's been postponed. There are currently 6 million people on NHS waiting lists in England. 1 in 20 of those people were waiting more than a year for help, and around 18,500 have been waiting more than 2 years to be seen. Details of a wide-ranging plan from NHS England to tackle that backlog was meant to be published today, but at the last minute the Treasury intervened and refused to sign off the plans. There were concerns over value for money after previous deadlines for hitting treatment targets slipped as a result of a spike in Omicron infections. The chair of the Health Select Committee, Jeremy Hunt, said it was alarming the plan had been delayed. More alarming that it was over the issue of targets. Here he is speaking to the BBC's World at One.
The last thing the NHS needs right now is additional targets. They have more targets in the NHS than any other healthcare system anywhere in the world. They're often counterproductive.
But it's not just the UK sinking under a backlog of elective surgery. In America, nearly half of United States states announced that they would postpone operations among them. New York, Illinois and Massachusetts have all implemented or recommended statewide delays. Dr. Anand Swaminathan is an emergency medicine physician in New Jersey, and he joins us. So tell me about the sort of effect that COVID has had on elective surgery where you are.
It's had a massive effect throughout the pandemic, not just in the last couple of months, but really throughout, seeing a lot of these surgeries be put off. And, you know, when people hear the word elective, I think the terminology is a bit off here. These are any procedure that is not an absolute emergency, but they are necessary. Elective doesn't equal unnecessary. We're talking about kids who have congenital heart defects that don't need the surgery right now, but they need it pretty soon. We're talking about people who have gallbladder infections that need those gallbladders taken out. There are so many different things that falls under that umbrella of elective. And pushing those surgeries off clearly does harm to patients. It means that we're not able to deliver the best care to the patients we see, which is something that we are not used to. We are trying as hard as we can, but without beds, without staff for those beds, we can't take those patients to the operating room, which, again, that delay in care, it's a backlog that I'm not sure that we can really ever catch up on, or when we'll be able to catch up on it.
We have delayed the plan here in England today to get on top of the backlog because there's disagreement over the targets and how to fund the targets. Does delaying it exacerbate the problem? Does it lead to greater numbers? Does the cost go up the longer that you fail to tackle the backlog?
Absolutely. I think that we do need an organized way to approach this. In the US, we don't have a nationalized healthcare system, which means we don't have a national plan to address all of those cases. Our system, and really our system, is broken in so many different ways. This is just another example of how our system doesn't work very well, especially when we look at the fact that a lot of hospitals rely on these procedures in order to stay afloat. Without that money coming in, they have a hard time making payroll. They have a hard time keeping the building together. We need those surgeries to happen. The whole healthcare industry needs them just as much as the individual patient needs to have that procedure done. And again, now, even as Omicron starts to subside where I am, it's hard to ramp up those procedures because so many healthcare workers are still out. They're out either sick or they have disability related to getting COVID. So we're having so many different issues in trying to get those rescheduled. And absolutely, the longer we put them off, the harder it's going to be to make them up and the worse it's going to be for patients.
Yeah, I mean, you talked about the different healthcare system, and I just want to drive that home for people. Figures are hard to come by, but I look back at the first wave of the COVID virus, the first wave, this is back in 2020, and over a 3-month period, US hospitals altogether lost an estimated $22 billion. $22 billion in 3 months. That's an enormous slug of money. And as you say, that goes on staffing, it goes on beds, it goes on properties. Does it also go on research and tackling future rises in infection?
Well, it's going to affect all of those different things. All of those different pieces are going to be hugely impacted. And what this really should be an impetus is for us to overhaul our system, to look towards a better system, one that is able to be flexible. What we have learned over the last 2 years with this pandemic is that the US system lacks flexibility in all different facets, whether it be the healthcare system, whether it be our public health system. And without investing properly, without really looking at that system and saying, how does it need to function for the people it serves? we're going to be in the same place again and again and again. We have a very inflexible system that isn't really able to adapt to these challenges.
Stay with us if you would, because I'd like you to take part in our discussion about this. Let me bring you in, Sonia, on this, because I want to talk about the the UK Treasury's decision, since you formerly worked at the Treasury. There is some reporting that the Treasury is slow walking this because they think there is a dying administration. Because Boris Johnson might be on his way out, they don't want to commit to a list of spending targets now, a scale of ambition they might not agree with when he's a dead man walking. What do you think?
I mean, I really recognise that situation because it felt like that in the last kind of year of Theresa May government, and there was this really strong view in the Treasury that this wasn't money for the current Prime Minister, it was from the next Prime Minister, and so they would stonewall everything. But the situation was very, very different then, not least that a leadership election had started and that we weren't years after COVID. So I'm really surprised by this decision by the Treasury, not least because there's rumours of Rishi Sunak now having kind of 13 billion pounds to potentially play with ahead of a spring statement, and he hasn't chosen to spend it on levelling up. We saw that white paper come out with very little new funding committed to it. We've got a package around energy, which is essentially a whole load of loans, so he hasn't chosen to spend it there. So what is the Treasury waiting for? And as we hear, it will only exacerbate the problem. So you would think from a value for money perspective, if you're going to be quite cold about how you approach it, you're either going to spend money now or spend more down the line. So I think it's very strange, and it reads like a political choice more than anything else.
Well, you're not the only one to say that. I've been digging out some tweets from Nikki DaCosta, who is the former Director of Legislative Affairs at Number 10. She's tweeted last week, before this decision was even taken, Number 10's power in Whitehall is ephemeral and very dependent on individual and personal calculations. If the person asking is not going to be in post much longer, they have less clout. I saw it under Theresa May, as you said there, Sonia, and private officers were emboldened by perceived political vulnerability. She goes on to say, the system will slow down, instructions may be challenged, departments will be more assertive. Number 10 can't fight Whitehall. It is highly dependent on cooperation. So you're saying, whatever excuses have been trotted out today, that this is a direct result of what is going on around Partygate.
Yeah, absolutely. I really think that, and hearing Nikki's tweet was like a real sense of deja vu, because clearly we have the same memory. But it's very, very strange because the situation is not like that, and there's not a clear front runner to replace Boris Johnson. And as I say, we haven't reached the threshold for replacing the Prime Minister yet. So I don't think you can compare the two quite the same way. But I think the big kind of question that it sort of leads to is, what is the government's priority? We're meant to have a reset, and we thought levelling up would be the cornerstone of that. And secondary to that was, this promise about kind of spending into healthcare linked to Brexit. But either of those haven't been funded. So what are they waiting for?
Yeah. Doug, let me bring you in on this, because you were listening to what the doctor was telling us about the backlog and the costs involved in that. We're in the midterm season. Crime, the economy, they feature very highly. But healthcare, if people aren't getting their hip surgeries, their knee joint surgeries, the surgeries that they expect on their healthcare, that must play very well for the Republicans.
It does. It hasn't risen to the kind of existential problem for Democrats at this point. That it could be, as we continue to experience this backlog, and Omicron has obviously really exacerbated that. What we see voters really reacting to in a most immediate sense is the pain that everyone is going through. And what happens is they go to their petrol station and they're paying more than they were before. And then when they go to wherever they were planning to go, well, they're paying more for their chicken, they're paying more for their beef, for their produce. That's if that's on the shelf. The empty shelf issue, the supply chain matters. And the rise in violent crime that we're seeing in every metropolitan area in the United States is really a driving concern for voters, because even if you don't experience it yourself, you know somebody who does, or you see something on Twitter or a neighborhood list share that something happened 3 miles away from you, a half mile away from you. And it's something that really is concerning voters more than the backlog. The backlog is a bigger and bigger issue as healthcare costs continue to rise as well.
And Doctor, just a final word from you. I mean, you were saying that when we talk about elective surgeries, it sort of makes you wonder or think about whether these surgeries could be postponed and they're maybe not that important. But of course, there are 300,000 people, nearly 300,000 people here who are missing a 2-week appointment because of a cancer concern. And we know that time is of the essence when it comes to cancer treatment. So clearly there has to be a way in both our systems to identify those most at risk.
I think we do need to see that. We do need to have a way to prioritize those. Again, your system is a little bit more comprehensive. Our system is a little bit more disjointed, which makes it more difficult for us to identify which patients need to go sooner rather than later, and then how to get them to that procedure, to that surgery, to that appointment, even if it isn't within the healthcare system that they typically go to, but to get them that procedure done. And really at the heart of this, Christian, is that the way for us to get through this is to get through the pandemic. The way that we do that is by embracing vaccinations. It is by doing the simple public health measures that can knock down cases, can help hospitals control what's coming in so that they can then start those procedures again. So vaccine mandates need to be a big part of this, better testing, better investment in public health surveillance, in ventilation, and then masking as well. All of these things need to happen for us to get ahead of this.
Dr. Anand Swaminathan, thank you very much for joining us on the programme. Lovely to talk to you.